When parents come to me and they want to help their child eat new foods, or they want their child to be less picky, I tell them that we're going to start feeding therapy. And feeding therapy is basically teaching the parent to be the best feeder that they possibly can be, to be able to make changes within themselves as a parent and being able to watch the dynamics between the parent feeder and the child, and then also to make some changes with the eater, the child, and be able to have them learn some new abilities, learn different ways to explore new foods, and make it fun, to be able to build that relationship between the parent and the child and make this feeding relationship be a happy mealtime instead of a struggle. Kids get referred to me usually around 6 months of age, and I think the reason why that is that typically kids are solely breastfed or bottle fed between birth and 6 months of age, and then they start to introduce solids. And sometimes the child starts to gag or retch, and so parents can be really pessimistic about their feeding. And so sometimes they'll seek out services to be able to kind of help them through that one bump in the road. And I will use that as a time to be able to educate them, to help them to prevent feeding issues in the future. But 6 months is usually when they start to come to me. And then again, between 2 and 4 years of age, when is a natural picky eating phase occurs, I get a lot of calls during that age as well. And I tell parents, if it's just that they're going through a picky eating phase, that's totally neurotypical. If it's past 4 years of age, then we need to get involved. The emotional state that parents are usually in by the time they get to me is they're completely defeated. They feel like there's no hope. They're feeling like their child is never going to eat a well-balanced meal. They're feeling like they're not good feeders. These parents are usually broken by the time they get to me. And it's unfortunate because they're getting pressure from family, they're getting pressure from the media, and not a lot of really good information. And that information is, you know what, this happens. And you can get through it, and sometimes just being able to be that first person that these parents are admitting it to, sometimes the first time that they're actually saying, I think my child has a problem, or I think that feeding is too difficult, or I even have moms say, I hate feeding my child, or I hate mealtime. And it ends up having this whole effect. Then moms don't want to cook. They don't want to be rejected because that's how they feel. When I'm doing feeding therapy with the child, but I'm also doing feeding therapy with the parents because they are feeling rejected and defeated and unworthy. And they're getting outside influences saying that we could do it better, grandparents, we could do it better, in-laws, we can do it better, the media, oh, you can do it better. And really, they can't. They don't have the tools to be able to feed children who don't want to eat. One of the differences between a picky eater and a problem feeder is the variety of foods. So a picky eater tends to eat 30 foods, which is around the range, and a problem feeder eats 20 foods or less. So when I have a parent that calls me on the phone and says, oh, my child is a picky eater and I think that they need some help, and I ask them how many foods they have and they say 10 foods, then I know that that's a little bit more serious than just typical picky eating. The norm for kids to be able to eat foods and not be classified as picky or as problematic is being able to eat any new food, try any new food, be willing to try any new food. And not only willing, but enjoying that new food. And so it could be a wide range. I've had 9-month-old that'll eat 50 or 60 foods. That is a child that is what we call typical. Typical range, typical variety, and typical in textures. The differences between using the words feeding and eating, I think, comes from eating disorders as compared to feeding disorders. Eating disorders are more like anorexia, bulimia. So when we say that a child is having difficulties eating, there's a social implication of, oh, your child is anorexic or bulimic. When actually, when we're talking about infants and we're talking about children, we're usually talking about how we feed them, how we as therapists, professionals, and parents feed them. The 2-year-old is eating on their own, but they're not getting the food themselves. The parent is still choosing what that child is going to eat, even though the child may actually be feeding themselves. That's a myth. There's a myth out there that unfortunately healthcare professionals are giving parents, and that is that if your child is hungry enough, eventually they'll eat. But there is a whole range of kids out there that won't eat, even if they are hungry. They won't eat because they either have reflux or it hurts or they have some food allergies, and so they won't eat. And so having them go to bed hungry every single night is not really good medical advice. Yeah, sometimes parents can be confused with how to feed maybe the third child when the first one and the second one ate fine, but now they have a third child and they're like, we did the same strategies with the first two. Characteristics are different, personalities are different. And I'll even have parents that'll call me and say, my kid's really stubborn, but I wanted to call and see if maybe there is another underlying issue. And kids don't become stubborn. That's not a thing that they want to do. Kids don't usually say, I'm waking up today and I'm going to refuse to eat my fruits and vegetables. They don't do that. They end up feeling that way because either they've been in a feeding environment unable to be able to do it, or they're not doing it the right way, or they're not able to do it. And so if you aren't able to chew a certain fruit or vegetable, you don't eat that fruit or vegetable. If you're not encouraged or taught how to do that, then you don't do it. Processed foods make it very easy. We can suck up a yogurt, we can eat things, a chicken nugget, it's all pre-processed, it's pre-chewed. And then we get an apple and we're expected to be able to chew it when we've never had to chew anything that's hard before. We have to teach them how to do that. And sometimes it's really hard to teach. What I try to teach parents to do in the feeding relationship is have really good language. We really want to watch what we say. When I'm actually at a mealtime with a family and trying to help them through the family dynamic, this is what I usually say. Well, let's give Johnny some broccoli. Let's give everybody broccoli. And the mom will say, oh, Johnny's not going to eat that in front of Johnny. So when we're talking about what our kids will and won't do during the feeding experience, those children are hearing that and then not eating it because they're like, oh, my mom already just said that I'm not going to be able to eat it. We have to watch our words. We need to watch our language and be able to provide a very open-minded feeding environment. One language usage that I'd like parents to avoid is saying good job, because of the fact that these kids some of these kids, it's really a job for them. It's really hard for them to be able to manage the chewing and moving their tongue in the right place. And so it really is work. And so if you say good work or good job, we're actually telling them that yes, it is work. We don't say good job when they're eating ice cream or cake. We only say that with foods that are a little bit more difficult, like meats and fruits and vegetables. And so what happens is that parents will think that they're actually encouraging them when the child is actually being discouraged by their words. So I try to replace those words with tell them what they're doing. If the Johnny is working on that carrot and it's really hard for them and Johnny makes that crunch and actually bites through the carrot, then I like to say, good crunch. I like the way your back teeth, use that for crunching. Or, ooh, that was a really loud sound, to be able to encourage what they're doing instead of using negative language. Some examples of negative language are, Johnny, don't do that. And rather than, I'd like you to use your utensil. Or don't pick up the food with your fingers. I'd like you to use your utensil. Being able to use positive language. I hear a lot of no's and can'ts in regards to the way that the child eats. If a child is starting to go for those blueberries and we tell them, no, don't use your hands, they're not going to go for those blueberries again. What did we just teach the child? We just taught the child that the way that they were just going to engage with that food is wrong. And so that child is less likely to be able to engage with that food, less likely to be able to eat not only that food, but anything that's that texture. So raspberries, strawberries, blueberries, we've just alienated a whole group of fruit just by us using the wrong language. I teach parents to replace their language of no, don't, can't, stop, to things that are more positive, telling the child what they can do instead of what they can't do. So, and being able to even prepare them even before the meal. Here you go, Johnny, here's your lunch. This is what I'd like to see. I'd like to see you, be able to use your back teeth. Okay, let's eat it together and have the same meal as them. And so that you're modeling, you're giving that social modeling of eating those same foods, and you're not having to say no. You leave out those words, those negative words when it comes to mealtime, and being able to encourage your child in other ways. And especially by modeling those behaviors, being able to eat that food. I teach parents to listen to their kids in the feeding environment. If your child is telling you they don't want to eat an orange because it hurts their tummy, really listen to that. Sometimes kids will say, I've told my mom this 3 times, and then we come to find out they actually have an intolerance, or they have an allergy, or they're having reflux with citrus. We really like to listen to the kids and really feel what they're feeling. Could it possibly be that there is an allergy? Can we replace that food with something else? Instead of an orange, can we give them an apple? Can we give them something else and see really what might be an underlying cause of that? And kids, sometimes they'll tell us. And if they're nonverbal, they'll tell us in different ways. They'll give you that tilt where it's kind of what we call a negative tilt. They'll give them that tilt like, oh, I don't want to have that. And they'll be able to explain, they're not able to explain to us why that is, but they're telling us still with their body language, and we just need to be listeners. We need to listen to what they're doing with their body so that we can say, I don't know why they might do that, and we have to look into that further. There could be a medical issue. With the kids that come to me that are picky eaters, I can slowly but surely transition those foods to be more healthier alternatives and educate parents to be able to get to healthier alternatives to be able to assist them. With kids who are problem feeders, first what we want to do is kind of expand their repertoire. We want them to try different foods. And so we want to expand those different textures. If they're able to eat eggs, great. Can they eat scrambled eggs, fried eggs, hard-boiled eggs? Let's try to expand those textures, because once we're able to do that, then I can start getting those crunchy, nutritious fruits and vegetables into them and be able to start to help them along the lines of textures. If they are not able to do a puree, then we don't do pureed smoothies with our fruits and vegetables. If they do like crunchy textures, and we'll try crunchier fruits and vegetables like bell peppers and carrots. Yes. There's a strategy that parents use sometimes, and I call it temptation. And really what it is, it's using food as a reinforcer. So if you want Johnny to eat broccoli, they will tempt their child, use another food reinforcer to be able to encourage their child to be able to eat that new food, broccoli. But what actually occurs is a mistrust between the child and the parent. And slowly but surely, as parents continue to tempt, they up the ante with the temptation instead of actually pulling back and thinking, what am I actually doing here? I am telling my child that broccoli is not a good food and that ice cream is a better food. And we start to lose that gap between trust between parent and child, where the child starts to feel, why does my mom or my dad have to feel like they have to up the ante in order for me to get this food? And then they start to mistrust their feeder. I try to educate parents about manipulating their children. If you are at a point to where you're starting to manipulate, you need to find other tactics. So I always tell parents, whenever you feel, ooh, I gotta trick or manipulate or bribe or cajole my child to be able to do X, then you need to find a new approach. Because kids are naturally curious. They want to try new foods. They want to be able to explore. And whenever we use tactics to be able to try to encourage that, that's when we need to kind of step back and say, what else could be another cause? Could it be that my child's not able to do this? Could there be some other underlying issue? So I always try to tell parents, don't manipulate, because we might need to find out what else is happening here. I try to tell parents that there's this continuum. There's this love and fear continuum. We use love sometimes in a negative way. So I hear dad saying, try this XYZ food because your mom loves you so much. Show her that you love her by eating your cucumbers. And it has nothing to do with love. It has everything to do with a child's ability to be able to eat a certain food, the child's ability to be able to chew or swallow. And then there's the fear base. It's wanting to be able to have your child eat these certain fruits and vegetables because you know they're healthy, because you know it's good for them, because you know it's going to help them. But you're fearful about not being able to have your child be successful with it, or you're fearful that the child is going to reject that food and thus reject you as a feeder. So there's this spectrum of being able to try to love your child, but still keep your fears at bay. Table manners actually comes up quite a bit in therapy. Parents want their kids to be appropriate. They want their kids to have good socialization during the mealtime, but I always try to encourage parents, wait until they've also met all their developmental milestones. So when we look at utensil use for a child to actually be proficient with utensil use is after 24 months of age. For a child to be proficient with their jaw and their trunk stability and their head stability, because remember, we're doing all of these things. We're maintaining trunk control and head control, jaw control, lip control, tongue control, and trying to use a utensil. All of those things come by 24 months of age. So before then, we are asking a child to do something that they physically can't do. So I always tell parents, we can do this, we can teach table manners, let's wait until they've met all their developmental milestones. After 24 months of age, start including table manners. Some rules that can impact children with their eating are rules that, when we were growing up, we might have heard, and then we eventually say that to the kids that we're feeding. And some of them are, eat all the food on your plate, or, we don't eat with our hands. And any of these types of language use that we use at the dinner table actually can cause a negative effect with our kids. So if the child wants to use their hands, they can. If they want to play a game, they can do that. If they want to explore those foods in a new way, we want to allow them to be able to do that. Because we want to, again, encourage the trust between a feeder and the child, and that all starts with language. Yes, playing with your food and kids that actually have the ability in the feeding environment to play with their food tend to eat more, tend to enjoy the food, and tend to have more trust with their feeders. Some symptoms and characteristics of feeding disorders are many, but we'll go over a few. One is gagging or retching when a new food is presented to the table. Any kind of issues with their tongue, their lips, their jaw, if they're not able to chew a food, if they're not able to manage that food, any type of drooling, issues related to be able to bite into foods. A lot of our kids will take a food and they'll actually tear it. They won't bite through the food, so that makes it difficult for kids to be able to eat. Other symptoms are that they'll eat with one feeder, like they'll eat with mom, but they won't eat with dad or grandpa or someone else, or they won't eat in different environments. They'll eat at home, but they won't eat at school, or they won't eat at the park. So putting all of these symptoms together are characteristics of a feeding issue. Feeding issues typically develop between 2 and 4 years of age. And the reason why that is that that's a normal developmental milestone. Our kids get picky between 2 and 4. And rest assured, so parents, if you're going through that right now, 2 to 4 years of age is the picky eating stage. If it lasts longer than that, especially if it's about 4.5 years old, all of that should already be done with. There's a phase called the neophobic phase, and that's when kids have neophobia, which is a fear of new foods. And that's typical between 2 and 4. Anytime after that, you might want to seek out help from a speech pathologist. There's several things that parents can do to prevent feeding issues down the road. One thing is to be able to actually know education as far as like posture and positioning. Posture and positioning is key. So you as a feeder being able to have the right position, so sometimes we might be there an hour or so feeding our child, so we want to be in a great position for them. We want the child to be in a great position. If you're feeding your child in the car seat, we want to make sure that the child's feet are stable. We want them to be at a 90-degree angle so they're sitting up so that they don't have any issues with choking or gagging. We want posture to be the key to be able to start a natural feeding environment and to start to decrease the chances of having feeding issues in the future. When parents come to me and they have questions regarding their fears with choking, I explain to them the differences between gagging and choking. One is that gagging is a natural way for our body to respond to a food that we're not able to manage in our mouth. So between 8 and 10 months of age, a child is learning how to eat foods. So gagging is going to be very common. In fact, we want to encourage that. We want to encourage these foods during that time to be able to move that gag response. If you can use my hand as an illustration about the tongue, we want to move that gag to be pushed back slowly but surely so that when a child actually does gag, they won't choke. So that the gag will actually do what it's supposed to do. It's supposed to help manage and manipulate another piece of food to come up so that the child can actually manage it. So I encourage parents to try foods, especially between 8 and 10 months of age, to be able to start to encourage that gag reflex and to be able to prevent choking issues in the future. Sometimes parents feel anxious when it comes to choking and gagging because that's actually a fear. The fear of not being able to assist your child during the feeding experience. And what I like to tell families is that there is a big difference between a gag and a choke. A gag is something that is developmentally appropriate, something that we want to encourage, something that we want to teach our kids through to be able to get through that experience and be able to still chew that food. A choke is that the child is not breathing. The choke is the child is having this miscoloration in their face. They're starting to turn blue. They're actually compromised their airway. So what I try to encourage parents to do is that if your child starts to gag, don't get panicked. Don't get anxious, because if they see you get anxious, they're going to immediately take that breath in because they're scared, and that food's going to go right down into the airway. So we want to make sure that parents stay calm during the gagging or choking experience and be able to help educate their child through that. Yes, during the time of introduction to these foods, earlier is better, just because of the fact that we want our kids to be able, when they're 2, to be able to have a really good gag reflex. We want them to be able to protect their airway, because safe feeding is the most paramount. That's why parents have these concerns to begin with. They want to make sure that their child is safe. The best safety prevention that you can do is to initiate foods early, so that, and you're supervising them to be able to help explore them. If Johnny puts that carrot too far back, then they start to gag, then you can say, "Oh, Johnny, you put that carrot too far back. Let's move it forward." And you're able to teach them and explain to them what's happening with their movements of their mouth, and also to be able to teach them later on, so that if they have a real choking incident when they're 2, that you'll know the difference between gagging and choking. There is a correlation between picky eating and obesity. And I think the reason that is because once a child learns picky eating behaviors, and once they are fundamentally off track when it comes to eating, then they'll eat foods to be able to make them feel good. And what usually makes us feel good is high carbohydrates, high sugars, high salts. And so they are not being exposed to healthy foods like fruits and vegetables. And my concern is that there's been a wave of movement with parents feeding their children, and it's been, well, we'll just sneak these foods in there. So if you sneak zucchini into a zucchini bread and your child eats that zucchini bread, you know, parents are like, yay, one win for us, my child ate zucchini. But really what they learned is that they like zucchini breads and other breads that look like that. They don't have that relationship with the zucchini. And so these picky eaters tend to be more and more problematic, and actually this goes into adulthood. And so we want to be able to try to help these kids early on, being able to explore these new fruits and vegetables, to encourage parents to try fruits and vegetables so that we decrease the chance of their child having obesity in the future. Social modeling is a way that kids can model other people's behaviors. So we can do that with video, and kids will be able to look at the video, be able to see the video, and try to model and imitate those things. Kids do that all the time. So it's their natural ability to be able to want to model that. You see kids that will watch a cartoon and they'll imitate that cartoon. They'll watch a movie and imitate their Buzz Lightyear. And that's a nice way to be able to teach kids. It's what we call a passive way to be able to teach kids. Instead of saying, Johnny, eat your cucumbers, you could watch a video modeling of a child eating cucumbers and have the natural ability to want to eat cucumbers. So that's why Copy Kids is so great, is because from a scientific standpoint, there's mirror neurons that we all have. We watch the Olympics and we look at that and we have mirror neurons in our brains that are like, oh, I could do that, I could try that. You want to be able to mirror that. You want to be able to copy that. And you may do that in your mind, and with kids, they do it in their mind and then they actively do it. That's why I love Copy Kids. It's so natural. It feeds into kids' natural desire to want to copy others. And so the way that I use Copy Kids in my therapy sessions is that we'll watch part of it, whatever food I want to work on, and have the child look at that, being able to have that social model right there in front of us and be able to work on that particular food. And I love Copy Kids' ideas of being able to have all the whole foods in front of you. A lot of the kids that I show the videos to, they've never seen tomatoes on a vine before. They didn't even know that that was a tomato. And then showing the actual video and them seeing tomatoes on a vine. I think that really, sets apart the way that, Copy Kids is presenting foods and the way that these kids are being presented foods at home. And so I think it's a really good transition to be able to have kids learn from other kids and being able to model those healthy behaviors. Children on the autistic spectrum tend to have eating disorders. Actually, they tend to have feeding disorders, and that is that they're unable to be able to eat a variety of textures, a variety of new foods, in a variety of environments with a variety of people. Yes, children on the autistic spectrum tend to be having more difficulties with obesity, with blood sugar issues, because of the way that they eat. Social modeling can help children on the autistic spectrum because it's giving them the model for them to be able to imitate. So using Copy Kids or another type of social modeling can let them know what to expect. And that's really what it is being able to let them know what to expect. And sometimes these kids on the spectrum need to know, what is that texture going to be like? What is the amount of juice is going to come out of that vegetable? What is the sound going to be? Because some of our kids on the spectrum have really difficulties with sounds when it comes to eating, which is why they eat more meltable textures instead of crunchy textures, is because they can't handle the sound. And so these social modeling videos are really important for these kids to be able to get all of this information before that food is even in front of them. I use Copy Kids in a variety of different ways, but one way that I use it is to be able to introduce a food that the child might be afraid of. So kids being afraid of foods is called neophobia, and that's typical between 2 and 4 years of age. After that, we want to be able to work and explore those foods that the child may be fearful of. Copy Kids is a wonderful way to be able to introduce a new food without the child having to eat it. It's a wonderful way of that child being able to see the drip down their face, to see how hard they have to bite into something. They're getting a lot of information, sensory information, which means how is that food handling, how is that food being handled in the mouth. They're getting all that information by being able to see this model before them and being able to see this fruit, so that if we decide to give them one of these new fruits and vegetables that's on the Copy Kids videos, they're going to say, oh yeah, the tomato was really runny, or oh yeah, the carrot was really crunchy, or oh yeah, I can eat the apple, it's going to take a big bite, I'm going to really have to open my mouth to be able to eat that. They're getting all this information before that food is even presented to them. So it's kind of preparing them, what we call their sensory system, their whole ability to be able to handle that food. It's preparing them so that it's not so scary. If you see kids on the video eating food and they're having fun and they're having a good time, it starts to take that fear factor down for them. And so they're not so stressed out. They're not so scared about trying something new. I think there is a stigma out there where parents feel uncomfortable seeking out help for feeding issues. And I think the reason that that has occurred is because of media. Picky eating's in the media constantly, but there's really not good resources out there when they talk about picky eating. By the time a parent gets to me, they've talked to their pediatrician, a nutritionist, several other medical practitioners, and no one's really given them help. I find that parents have difficulties with in-laws, and so grandparents and well-meaning people will say, oh, if just give me a day with your child, I'll get your child to eat. And so these parents are feeling so defeated. And so they are feeling like the stigma of, I am not being able to be a good parent because I can't feed my child. When actually that's not true. These kids sometimes have issues with being able to move their jaw or their tongue. It has nothing to do with parenting skills. If they have difficulty swallowing, it has nothing to do with parenting skills. And by the time they get to me and I say, actually, your child has these following issues, and they wouldn't be able to eat whether or not they had you as parents or has me as a parent. They are not going to be able to eat until they learn these skills. And sometimes that can be very beneficial for parents to be able to hear that it's not them. Copy Kids can help other moms by being able to be that venue, that voice, to be able to make picky eating okay. Some kids are picky eaters. Some kids go through the picky eating phases and continue to be picky eaters, but it's okay. There's resources out there to be able to help you. Copy Kids is one of them. Seeing a feeding therapist is another one. There's resources out there to be able to help parents so that it's not a struggle, so that mealtime doesn't have to be such a challenge. It actually can be fun, and we can make it fun.
Copy Kids!